think it's always important just to remind folks why we're working on parallel tracks, which is to say that we at One Pair States, we've been around since 2009. And this group, One Pair States, came together actually out of a U.S. Senate race I ran for U.S. Senate here in Pennsylvania back in 2006. And what we were able to do in the course of that campaign was to bring together these disparate elements. Geographically we're divided, but we brought together a movement of a single payer movement in the state of Pennsylvania. So anybody who said to me, "Gee, Chuck, I'm sorry you lost," we didn't lose. We built a movement. And that's how we need to be thinking about the work that we do. Running for office isn't just about winning the office per se, but it's about building a building movement politics, right? And bringing together coalition partners. But the idea behind state-based, so I was running on the national single payer bill. I mean, I was running as a Bernie crap before Bernie came into national prominence, sort of following the lead of Paul Wellstone, Minnesota. But the point about working at the state level is there are 50 states, and we have opportunities to model a universal healthcare system. And many of you know, most of you know, that that's the way Canada got to a national system, right? Through Saskatchewan, Tommy Douglas, who's regarded as the George Washington of Canada. And this is our theory of change. I've been in politics for now over 50 years, since I was 13 years old. And so the idea here is to get as many states pushing forward simultaneously as possible. Since Washington, D.C. is broken, there's just no two ways about it. I'm lobbying on Capitol Hill. I cold call most of the time. I talk to anybody who answers the door, the internist, all the way up to the chief of staff, and sometimes I run into the members and have a chance to pitch them. The State-Based Universal Healthcare Act has been around for several years. Jim McDermott carried the bill, and then Pramila Jayapal, who is the first co-sponsor on the bill. Pramila talks about it a lot. Bernie talks about state-based universal health care as well. The point is that we're working in parallel and coordination with everybody so that we can get, as David Loud says, to the gold standard, which is national single payer. That is our goal. That's our objective. How do we get there? So that's the theory of change. We have to build a movement. We have to connect ourselves. This is something that we're doing very intentionally with One Pair States, is connecting ourselves to other social justice campaigns and movements. We're not big enough. Single payer folks are wonderful people, but on a bright, shiny day, we have about 250,000 people that we can count. And that's including all the nurses, right? So what we've got to do is we've got to collect ourselves. And my view is that in order to win on healthcare justice, we have to be pushing on what we call health justice, which correlates with the social determinants of health. So it's about housing, it's about policing, it's about climate, labor rights, student loans and so forth. All of these issues have got to be seen intersectionally. We have to be thinking strategically. This is really, 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 really important. I'm in this to win. I'm not here just to kvetch or complain or, say how horrible our healthcare system is. How are we going to fix it? How are we going to get there? And so this is why we do the work at the state level. The legislation, the State-Based Universal Healthcare Act, and I'm going to drop the link for it in the chat. But it's design, which is being carried by Representative Khanna, who's a huge supporter of national Medicare for all. He calls it Medicare for all through the states. And that's how I want people to think about it. But when I lobby on Capitol Hill, we have 112 members who have signed on with Pramila's bill, voting members of Congress. That's 1/4 of Congress, just over half of the Democratic caucus, not a single Republican. But with the state-based approach, we have a real crack at getting Republicans and more center-right corporate Democrats on board, because they don't have to deal with the details in Washington. Send the waivers with guardrails, send the waivers for financing and the legal protection of ERISA, the Employee Retirement Income Security Act. Send those waivers out to the states and let the states model universal healthcare systems. And then we can prove to the nation it can be done at the state and, for that matter, regional level. This legislation actually encourages states to collect their efforts regionally. So I was just talking to the legislative director in John Tester's office, right? Montana. Montana is a small populated state, though it's massively large, right? Physically. But when I mentioned this to her, she said, we would love to work with Washington and Oregon. We would love to collect our efforts and to bring universal health care into the state of Montana. So this has got real appeal to people who think that states should be the incubator of ideas. And frankly, this speaks to our history and our Constitution. This is how we've been able to achieve the vast, vast, vast majority of our social, political, and economic reforms in this country. Remember that the progressive era started in Milwaukee, then went to Wisconsin, and then TR took it nationally. Same thing with the New Deal. All those programs were modeled in Albany, New York, when FDR was the governor. We've got to remember this history. This is who we are. We want to work with all of these vast majority, these partners in justice campaigns. So this is the reason why we do this work. And in terms of the economics that somebody mentioned earlier, this is we've demonstrated. I mean, Jerry Friedman has done at least a dozen state-based economic studies. He's a very dear friend, and he's done the national bill as well. We can do this at the state level. We can model this. So I just want folks to understand that I wouldn't be doing this work if I didn't think that it was the cutting edge of the kind of politics that we need to do. I also operate in my other organizing space, fighting against fascism and also promoting democracy. But this work is connected to all of that. This is very central to it, and this is achievable. So our goal is to get to 218 members in the House, 51 members in the Senate, and get the president to sign it so that states that are close to implementing a universal healthcare system, like Oregon, like Washington, potentially Minnesota, New York, Maine, Massachusetts, a few others, then we can really get traction, hit the road, show what we can do, and demonstrate that this is the pathway forward in our country. Washington, D.C. right now is broken. We've got to move forward where we can, and so we're very opportunistic that way, looking at where we can move forward. So right now, the bill in the House, did we get that in the chat? The House bill, Mike, can you drop that HR 6270 or somebody?
I'll put it in.
Yeah. And then we're also, just to know, we've got that bill that's in the hopper. It went in November. We've got 29 members, including a couple of conservative Democrats. We're working very hard, and I think we're close to getting some Republicans to sign on in the House. On the Senate side, we're looking for a senator. Maybe it's Maggie Hassan in New Hampshire, or Jeff Merkley in Oregon, and either the two senators in Hawaii or New Mexico. We just need a senator to run the bill up because the Democrats are in the majority and we have a chance to get hearings. We've got to educate around this issue. It's not on the radar screen of the vast majority of members of Congress. They just don't know it exists. And once the conversation happens, light bulbs go off in their heads and they say, why didn't we think about that? Why didn't we think move forward on that? So the House bill is moving forward. The Senate bill, we're looking for a companion Senate bill, working to get Republican representatives on, building out our coalitions, and also just know that we're working to build alliances with additional constituencies. In November, we did a summit focused on veterans issues. We're looking at the VA. Some people are even talking about expanding the VA to make it VA for all, which would essentially sort of mimic or approximate the National Institute of Health. I have to say that there's no appetite for it right now in Washington, but let's get the conversation going. Let's get veterans involved in the fight. We're doing a disabilities event. So Carl is going to be part of that. That's on March 23rd, if you want to pencil that in, March 23rd from 12 to 2 Eastern time. We're going to bring the conversation in on disabilities. Likely we've got Debbie Dingell from Michigan, who's the chair of that caucus. So this is the way that we're working in parallel track. We're pushing out a social media campaign. And then probably most critically, we're dropping a petition, a national petition next Wednesday. And it's going to hit the inboxes of millions of activists across the country. And this is going to take our campaign to the next level. And so we're very excited about where we are, where we're going, and we're dearly thankful that you all are here in the fight and you're listening intently on what we're doing, because our goal, again, is to get to improved and expanded Medicare for all, to restore Medicare, to expand Medicare, to improve it for all Americans so that everybody can access the best quality healthcare in the world. That's got to be our goal. That's got to be our objective. And the other thing is, we don't want to allow the right wing to run away with patriotism. So one of the things that we're doing is we're using the acronym USA, which is universal, simple, and affordable, USA. Universal, simple, and affordable healthcare for all. So language matters. It really does. Framing matters, the way you discuss these things. So when I go in and talk to members of Congress and their staff, I'm listening very intently. What are your ideas on universal healthcare? Well, you've got a seat at the table. We want to make sure that everybody brings their best ideas to the fore. But we all know here in this circle that really single payer is the only way that you can functionally finance universal, comprehensive healthcare for all. So bring your ideas forward. If people want to talk about the public option, let them talk about the public option. We're going to need their votes to get to 218 in the House, 51 in the Senate, and then get the president to sign it. So that's the entire that's the purpose why we do this, why we need to get support behind HR 6270. It has a real chance of passing within the next 2 to 3 years. I relocated to Washington, D.C. I'm committed to this fight. It's a volunteer effort. You know, I'm living on a Social Security check. So anybody who wants to contribute to the work that we're doing, believe me, you're paying for my metro ticket to get to Capitol Hill, 20 minutes away. I'm busting my tail. Everybody else in this organization is busting their tail, and we're going to win because we're committed to it. We've got a vision of seeing the success and how it is that we're going to get there. That's what we work on every day, you know, sort of envisioning that success and then reverse engineering, asking the questions, how did we get there? How did we get there? How did we win in terms of building coalition partners, the language we use, creating new models of leadership, resources, timelines? All of that has got to be thought through very carefully in creating a strategy to win. So I'll stop there and see if folks have any questions. But please, if you haven't already done so, drop your contact information if you're interested in working on this campaign, plus your email address, your contact information, and we'll work together to get your member to sign on with this bill, to get them educated and signed on. So thank you ever so much for everybody being here and being part of the fight. Questions, comments? I know we're past the top of the hour, with all due respect to people. If you need a dash, I put my contact information in the chat. You all know how to save chat?
No.
If you go to the bottom of the chat, there's those three little buttons. I don't know if you can see them. Let's see. You click on those buttons and then it will give you the option to save chat. Just click save chat. See that?
Three
Those
dots,
little
three dots, call them dots, 3 dots.
dots. Sorry. Yep. So that's how you do it. You click on those 3 dots. There are 3 emojis to the left of it, or whatever those are called.
And then what?
Save chat.
So
And then you've got it.
Sorry. And then what? So you save the chat, and where is it?
It'll appear when you close down the Zoom. When you exit the Zoom, it'll pop right up on your screen.
Okay.
It'll be there, right there for you. And then you can print it, you can download it, you know, but at least you've got that information saved for you. But while the meeting's open, the links are hyperlinked. So if there's something that you want to see more easily, more quickly, just click on the hyperlink. You know, they're emboldened in blue. So mine
doesn't say save chats. Click on the 3 dots. I have lots of things, but not save chat.
Me
Really?
neither.
The 3 dots are at the top in my computer. And by the way, I'll send the chat along with the recording of this meeting to all of you.
Yay.
Oh, thank you.
Okay.
Thanks, Mike.
Okay. All right. So we're fired up. We're going to get this done, and really looking forward to working with you, Ken, and everybody else who's in this fight, because this is a real opportunity. I think this is why we're doing this work, is to get to national Medicare for all through modeling. And this is, again, is how Canada did it. And this is how we achieved any number of things, including suffrage, child labor laws, and so forth. So this is our theory of change. And yeah, anybody can contribute. Really appreciate whatever you can do. $5, $10 a month, whatever. That's great. And Robbie, great to see you, brother. Really appreciate you're doing this work, and looking forward to folks doing did you put the Social Security Works link in the box?
Yeah, I put it in the link. Chuck, I guess I have a question for you.
Please.
And I don't want to hold people up, but so how do you see how do you see it if we don't stop the corporate takeover of Medicare?
Right.
How does that play out in terms of a Medicare for all struggle?
Well, we are in that fight too, as you know. I mean, this is what we do. I agree with you. We've got to stop the privatization of Medicare, and that's just the work that we do also. We work in parallel track with that. We work in support of the Jayapal Sanders bills. But you're 100% right. You know, the way the theory of change here is that we don't just we're not just in a defensive posture, but we're in an offensive posture, because it brings, I think, more energy to the fight and meaning. Like, this is what corporate America wants us to do, is to be on the defensive nonstop. And it's not just in healthcare, as you know. I came out of higher education. I was organizing, a labor organizer. I organized my faculty. I was ultimately fired, but we won the union. But that's what's happening in higher ed. This is what's happening in sports. This is what's happened, obviously, beginning with the military industrial complex. This is what corporate America does. We're in an existential battle with the billionaire class.
Yeah,
It's the
I don't
billionaire class that have taken it all over, and we've got to push back. So I agree with you 100%.
I don't disagree that we got to be on the offensive, and that was that had a lot to do with our development of leveling the playing field.
Right. That's all.
Was being on the offensive, because and and that was also, given the trend that's going on there, that was the only way we could figure out to defeat the takeover of Medicare Advantage, the corporate takeover of Medicare. But at any rate, I don't want to extend this any longer. I just feel like it's so important for people that are in favor of Medicare for all to understand that what we don't want is privatize Medicare for all. We have to win the battle to turn that around.
100%. That's why you're here, brother. I mean, this is why our home is your home.
Thank you.
Yep, you got it.
Chuck, if I might say something briefly, Robbie, I think you're painting a dystopia that we've seen whether it comes to weapons in America or other issues. But one thing that is worth remembering is Medicare is contracted out like the defense industry, except Medicare makes paper policies. They don't make planes. If they made planes that crash, they'd be basically reviewed a lot more with more scrutiny.
Right.
And I think that people don't realize where their taxpayer dollars are going.
Right. I agree. That's part of what we're trying to do, is educate folks around that.
Yeah, we're all connected. Ann?
I know we're trying to end, but Chuck, are you in contact with the Poor People's Campaign? And they're holding a big event in June in Washington, DC, a march, I think. They're a group that has like a package, an agenda that I would call a benefit plan for Americans, healthcare, childcare, housing, nutrition, the whole agenda that we're talking about that contributes to health. And it seems like they're trying to unify 140 million poor and low wealth Americans across the spectrum.
Right.
Are they a good partner for us for this?
Yeah, absolutely. I'm very close friends with the organizers up in Pennsylvania, and we've got one of our board members is very close to William Barber. But I mean, what you're speaking about here, and we spent some time the other night, we did a program called The Four Freedoms in the Fight for Healthcare Justice. The Four Freedoms references FDR, right? So that was freedom from fear, freedom from want, freedom of speech, and freedom to worship. And the idea, he just sort of distilled down our purpose for why we were fighting the Second World War, even though it was a year ahead of time that he made that statement, because we knew we were going in at some point. That was in January of 1941. And then fast forward to 1948, and Eleanor Roosevelt lead authors what we know now as the Universal Declaration of Human Rights. And the UDHR includes, of course, healthcare and housing and education and job
fair
dignity,
wages and
everything. And this is what I aspire to, it really is a sort of what you might call a radical vision for the future. This is what we've got to collect ourselves around and really believe in it and see it. My point of reference is Edward Bellamy's Looking Backward, a book that was written in 1887, and it starts in Boston, 1887, but the character in that story is transported to the future, Boston 2000. And Boston 2000 is a utopian society. And he wakes up You know, he was actually entombed. It's a science fiction, but nonetheless, he wakes up and he asks, why is everybody taking care of each other? Why does everybody have health care and good schools and clean water and clean air? How did that happen? Because he's coming out of the Gilded Age, right, of the late 19th century.
Mhm.
And he has this extended conversation with his host, the physician whose house he woke up in. Right. It was his house a century earlier. But the point is that that's the kind of strategic process and thinking and methodology that I follow very clearly. And that is, we have to see the success and then keep asking ourselves, how did we get there? But you have to see yourself having won already
Okay.
to give yourself that, to me, that energy, that focus, and that vision to keep yourself focused, because we're distracted all the time, right? There's so much negativity coming at us. So anyway,
Well,
I'll
and
stop
it
there.
seems to me that fighting each little fight with all of these specialty groups is keeping us not only fractured, but exhausted, and we never make progress, really. And the billionaire class knows how to keep us from it. They stop every organization every step of the way by
Right.
throwing up roadblocks and money. If we all unified around a package of benefits, and and like every other, social democracies in Europe, they've got this all figured out: childcare,
Well,
healthcare,
and-
housing.
Right. Well, take up Viking Economics by George Lakey, and he talks about how the Scandinavian countries basically took most of these American ideas and perfected them in Scandinavia.
Mhm,
Most of them were ideas that originated here, including our prison system.
mhm.
But we've turned our back on those very ideals. That's the irony. And anyway, Cheryl, you had your hand up, and then we should probably put a wrap on this.